Hey, we are live and thriving. I love it. Hi, I am your host for today, Ashley Jackson with Timeless Dream Events, with my lovely, beautiful sister from another Mr. Miriam Baldwin, all the way from the Netherlands. Miss Miriam, please introduce yourself to the listeners.
Thank you so much, Ashley. I can't wait to dive deeper into this subject we have today. My name is Miriam Baldwin. I'm a caregiver to both my husband and my brother. I'm the author of Caregiver 2.0 From Burnout to Powerhouse and the proud creator of the recently launched program 21 Days to Balance Caregiving.
Yay!
Woohoo!
Congrats, Miriam. I
Thank
can't
you.
wait. I can't wait. Caregivers need it. But without further ado, I do want to introduce our guest speaker for today. I cannot wait for this discussion. I know us as caregivers, we really need this. What Venus Senior has to tell us today. She is a medical billing benefits specialist, and she has written a book called Is Your Cash in Your Doctor's Stash? And honey, when you read that book
Mhm.
or listen to what she has to say today, you better be checking to make sure your cash ain't in your doctor's stash. All right. So without further ado, Venus, you have the floor. Introduce yourself. And thank you for
Thank you,
being
thank you, thank you for having me, Ashley. So, guys, my name is Venus Senior, aka the Patient Account Detective.
here. Love it.
I am a certified revenue cycle specialist, a healthcare payment strategist expert, and I am here to share with you tips on understanding your medical bills. And yes, I am the author of Is Your Cash in Your Doctor's Stash? So if you haven't gotten a book, please get the book. We'll give you more information and details at the end of the broadcast. But yes, thank you for having me, Ashley.
Yes, and not to mention everybody tuning in live. Please engage. Please give us those likes. Any questions you have, please
Yeah,
respond.
yeah.
Wherever you're tuning in from YouTube, Timeless Dream Events Facebook page, or the caregiver group that I admin, please send us your questions. I am giving a copy of Venus's book Is Your Cash in Your Doctor's Stash Away to one person who is engaging in this live. So thank you very much. I particularly don't even know where to start. I read your book in one day. Um, and I think I even messaged you and Miriam. I cried
Mhm.
when I read it because this whole medical billing situation is so frustrating. It's it's hard, especially on us caregivers who we're pulled to one side because we are trying to take our person, our loved one, to the doctor. We're trying to make sure sometimes in some cases that they stay alive, that they're getting the treatments that they need to get, they're getting the medicines that they need to get. So what what is the biggest issue that you see come through? um
People, individuals just not understanding the cycle itself. In the industry, we actually call it the revenue cycle. But for customers, patients, it's more so. I guess the biggest thing that I see is that they just don't understand. And when I say understanding, I'm talking about their benefits,
mhm.
what they really do and do not owe, what they can be billed for, how to dispute, certain things as it relates to their medical bills, how to ask questions and really get understanding. Again, the biggest thing is just understanding the whole cycle, and it is a cycle.
And what do you mean by that cycle? Can you dive a little deeper into what that means?
Absolutely. So, from a medical profession standpoint, we call it the revenue cycle. Okay. And the revenue cycle is when, from start to finish,
Mhm.
of the treatment of the bill. So when a patient comes in, this is the beginning. The patient comes in, or actually, I'm sorry, the beginning is you call and you make your appointment. Okay. You make your appointment, and then after your appointment, you go in to be seen by the provider. After you're seen from the provider captures all the details of that visit. They then send that information on to what we call a charge entry department. From charge entry, then it goes to a coding department. From the coding department, it then goes to the billing department. From the billing department, then it goes out to your insurance carrier. From your insurance carrier, it comes back to the provider. And then to the provider, then we deal with, okay, is this response that we receive from the insurance company, is this the final say? Is there something we need to do as the provider? Should we appeal? Is it something we need to reach out to the patients about to get them involved? It's a whole cycle. That's just pieces of it, because each individual piece that I just shared, it does and can involve more in-depth research, review, even before those steps that I just shared happens. So for instance, when I say that you call in, you make your appointment. Okay, you make your appointment, you go see the doctor, but before you go see the doctor, the provider should, if you have insurance, they should verify. Is your insurance active? Is that benefit, the service that you're having rendered, is it covered? Is there any out-of-pocket expense that the patient should be paying up front? Are there any waivers that should be signed? The details of the benefit verification is very important and should be discussed at the time of service or at the time of the appointment registration, because that actually gives the patient the opportunity to decide then, should I go forward with this appointment? And when I say that, because we have to look at what are the out-of-pocket expenses? Am I able to meet this obligation? Is the doctor in network or out of network? So that's just one piece of it. So that's why we call it a cycle, because going through the cycle, there's also a lot of in-depthness that we have to look into to make sure that the billing process is correct.
Yeah. So if
I'm
the
tired.
so if the provider doesn't ask these questions, Venus, would you suggest that the patient ask these questions him or herself?
Absolutely. And that's why it's important. And that's why I have actually, this is why I've decided to help you, to help, the community to understand. I've been doing this for over 25 years and working with multiple facilities. This is the trend all across the board. So if you go to a provider office, and let's just be clear, when I say provider, a lot of times, probably 99% of the time, you're not actually dealing with the provider himself or herself. You're dealing with the billing staff. These are things that the billing staff should actually talk to you about, whether it's the registration department, whether it's the appointment line. And if they don't, then these are things that you should be aware of that should trigger you to ask yourself. However, I do believe that when you're going to see a provider, because it is a practice, you're getting health care and a service, that this information should be asked to you. It should not be on the patient for most of it. But it is very important for the patient to understand their benefits. So if these types of questions are not asked, then you won't be left, in the blind when the bills come.
Mm-hmm. Yeah.
Okay. When the bills come, because they will come.
Yeah. Yeah. That was exactly my point. Ask the
Mm-hmm.
question, and when the bill comes, see if it's correct, right? Because this is
Correct.
something you talk about in your book. Check your
Mm-hmm.
bill. Check your
Mm-hmm.
bill. Document your calls with a provider. You
Mm-hmm.
know. So yeah, you share so many nuggets in your book. It's so much, right,
Mm-hmm.
Ashley?
Yeah, absolutely. I'm just trying to uh, figure out what a follow up question should be because, and I can only speak as the actual caregiver, right?
Mm-hmm.
So, like for instance, when my fiance at the time was diagnosed with a rare cancer and it was already in stage 4 by the time we were sitting in that office and he was diagnosed. um, we didn't have that like opportunity or that thought process to be like, well, maybe we should ask how much this is going to cost. It was either do what they said or he was going to die. And not to be dramatic, but that's what we were looking at. So at what is there anything set up in the system, which I think you do want to do, but is there anything set up in the system where someone is reaching out to these people? And I was 31 when he was diagnosed. I didn't know what I was doing, one, as a caregiver to someone with a rare cancer, and
Mm-hmm.
two, we didn't know to think to ask these billing questions or what that would look like. Is there something in the system that like kind of triggers to be like, hey, we should maybe reach out to these certain
Mm-hmm.
cases or all these
Mm-hmm.
cases or
Yeah. So, when a patient is going through treatment, and that's such as what you just shared with us, they have, or the medical industry has, within that facility, or the doctors or providers that you or the patient is working with, they have what's called case managers.
Mm.
And when what happens is when a case manager gets involved, they're looking at your medical record in detail. They're looking at what services you may need. They do communicate and collaborate with all providers that's associated with the care. And yeah, so there is something in place. But here's the thing. So I myself, in the book, I shared with you guys two stories. My dad, who had cancer, and he passed away very short period of time. We went to the emergency room, and the providers pretty much told us that he had issues with his gallbladder.
Mm.
Because of his current health situations and conditions, that facility could not treat him. So they had to move him to another facility.
oh,
When we got to the other facility, they ran a lot of tests, and they did share with us that my father had cancer. Well, let me say this. Let me back up. Initially, they didn't say he had cancer. What they said is that they found spots throughout his body. Unbeknownst to me, my father didn't share with me. Probably maybe a couple of months ago, he had went to his doctor and they had ran some tests, and his PSA levels, which providers, when they look at that level, kind of lets them know if a patient may be up against, a cancer
mhm.
battle. So that information was disclosed to me. Immediately, my dad was admitted. He did get a caseworker. He decided, within a couple of days or a couple of weeks of being in the facility, once it was shared with him that he had spots, he didn't want any tests. He didn't want anything. And because of the views that they saw, they pretty much said it's cancer, without actually doing, or because he wouldn't allow it to do the actual scans that would let them know that it was cancer. So his communication with his previous provider, and then hearing with the oncologist that reviewed the scans that he did get in the hospital, it was cancer. And so he was assigned to a case manager. His case manager spoke with us. My dad decided he wanted hospice. He didn't want any treatment at all. And I kind of had a problem with that, but I was willing to accept his wishes and what he wanted to do as it relates to his health. But my concern was because, I know from a professional standpoint, doctors can view certain things because of their history, in their training, in their experience, that they can look at, certain things and say, hey, this is what it is. But that did not happen. And so, okay, my dad decided that he did want the hospice care. When he got the hospice care, we had the case manager who looked over his case, looked over his insurance information. They asked us about his financial situation, not knowing that I myself was in the healthcare field. I didn't disclose that to them at all. So I wanted to really see what they would provide us with as it relates to all of the information that could assist us in accommodating my father's wishes. The case manager, again, I didn't disclose to them what I did and what I knew. They gave us some options, and those options were where he resided in at that time, receiving his care. They told us, after we shared, his financial stability, his insurance information, which they had on file, that he wouldn't be able to. They couldn't move him to a facility that could pretty much assist him with the end stage of the life transition because of his financial situation, they told me, and because of his insurance, because of the state that we were in. We were in one state, his insurance was, he had Medicaid and Medicare, which was, his Medicaid was in another state. They called around, there was no beds, to transfer him to the facilities that would take his insurance, the Medicaid. And I guess probably after a couple of days after they looked, they decided to do hospice care in the hospital. And which to me was very heartbreaking, I would say. And the reason why I say that is because they told us that they couldn't treat him initially, do the hospice care in the hospital because of his coverage. Then they told us they couldn't transfer him because there were no beds. Then they said that the facility that they thought they could transfer him to, that there may be an issue in the monies that would be due after they even took his the income that he did have. So they looked to family to come up with this with the balance. And when you're talking about patients that we know that's getting ready to go through an in-life transition, because face it, with hospice, you can recover for hospice. I'm not going to say that hospice is an absolute death sentence, but when kind of the prognosis and, what providers have shared with you about specific cases, then you kind of know where it's going. But again, we're not God. So, anything can change, but it was just disheartening to go through that process where I felt like, okay, it's not really about the treatment. It's about, are you going to get paid? And how are you going to get paid?
Wow.
Because we ended up doing the hospice at the facility. And it, just it's frustrating when you as the family, you're there, you're talking with the professionals and you're trying to, get certain things done, provide, information. And they don't give you very much information. And honestly, it's just a matter of, are you covered? Where can we put you, and what insurance will take you? I'm sorry, what facility will take you with the insurance that you have?
Yeah. So Miss Veronica, she actually said, because of finances, they decide the care that they are going to give, and that's horrible. Um, I know my mom, if she's on, can back that up too. She's had experiences with nursing homes, and her mother. The insurance provider decided where her mother was going to go, despite whether they were going to give her the best care or not.
Mhm.
I just I find all of this confusing, and I feel like they do it on purpose
Mhm.
because because and I would like Miriam to share what she shared with us earlier this week, how it works in the Netherlands. Like, it just seems so cut and dry, and it's
Mhm.
like, why can't it be like that here? Where Miriam was surprised when we shared with her, Venus, that we can, one person from one hospital visit can receive multiple different bills, because you're getting billed from the hospital, the doctors that came in and maybe saw you for 5 seconds, the anesthesiologist that put you to sleep in under 5 minutes. I mean, the list goes on and on. You can get like 10 different bills from one hospital stay. And Miriam, can you just tell everybody what happens in the Netherlands?
So here in the Netherlands, it works like this. For instance, I pay a monthly amount to the insurance company. I think it's around $160 US dollars per month, and I have a basic insurance with an upgrade. You can upgrade to level 1, level 2. So when I go to the doctor, the emergency or whatever, I don't have to pay extra because most of the things are um, covered in the amount I pay. I do have, I think you call it a co-insurance of 407 US dollars per year. So extra cost, medical cost made above that amount, 400. For instance, if I go to the I need surgery and part of it is not covered, and for instance it's like 500 US dollars, I'm just making this up, I have to pay the $407 first, and then the insurance company will pay all that's above the $407, but I don't get a separate bill from um, the anesthesiologist or the whatever, we
Mhm.
don't get separate bills here.
Mhm.
Yeah.
And the basic insurance here, practically all surgeries are covered in the basic insurance here in the Netherlands.
Mhm.
I pay like I think $20 per month for this amount. I
Yeah.
have two treatments for the how do you call this, the dental hygienist, is that the
Mhm.
name,
Mhm. The
and
dentist.
the dentist. So
Mhm.
I can go to the dentist and the dental hygienist
Mhm.
for $20 per month,
Wow.
each of them twice a year, to make sure that, so this is practically how it works in the Netherlands. And we are not even the best because for from what I know, Germany, the insurance is better in Germany and the Scandinavian countries. So when I heard from you what you are doing for, all the patients, I was like, whoa, this is
Mhm.
very confusing for the patients.
Mhm.
And I'm so happy that you wrote your book because you are really dropping gems in your book.
Yeah,
Thank you.
absolutely.
Yeah.
Yeah. Um, it just makes it so discouraging, and like I said, confusing, because you can send in a payment to one provider thinking that you're paying
Yeah.
the whole stay or whatever off after, um, and then after it's like, okay, you're still getting the bill from that same date,
Mm-hmm.
the same stay, but it's
Mm-hmm.
someone else that's, coming to collect.
Mm-hmm.
So I do want to go to, I made a ton of notes and highlights
Mm-hmm.
in the book. There was one thing that kind of caught my eye.
Mm-hmm.
I can't remember the figure now. I don't think I highlighted the figure, but what is the figure again of how often the billing or provider, I'm not sure which it was, how often do they get the bill wrong? I think it was like 80 some,
Whoa.
was it 80
So that
some?
number was very large. We're talking about in the thousands.
Mm.
Okay.
Okay.
In the thousands, that a patient may receive an incorrect medical bill. And it's a lot that encompasses, what's wrong when you receive a medical bill. I believe that was in, if I'm not mistaken, chapter 2. Um, I believe it was in chapter 2.
I think so, because
But
I made a note to ask how many times does
Is
this
this
happen.
is this the part? Is this
yeah, it's actually
the
actually I take that back. It's actually millions. Let's look on page 14. Over 186,504 people receive a bill that did not belong to them. And this was statistics that was looked at in the 2018 population of 327 million people. So there's like thousands, and that was just 2018. So now we're in 2022. So I'm sure it's probably up from that time. And especially, we're in this situation where we're dealing with COVID. And there is a lot of misunderstandings with what patients owe and do not owe, even as it relates to the ongoing changes, for that service. So the amount of medical bills that people are receiving that's incorrect is so alarming.
Wow,
I mean,
amazing.
we're talking six figures.
Yes.
And I really, when you gave the step by step when you're looking at your bill and your book,
Hmm.
I'm like, all
Hmm.
right, next time my husband gets one in the mail, I'm be
Hmm.
looking now a little
Hmm.
closer. Okay,
Yeah.
does it say his first and last name? Does it say, because we always put his middle initial on his
Hmm.
things. I'm gonna make sure it has all three things. I'm gonna make sure the
Hmm.
address is right, the
Hmm.
birthday, the social. Oh, I'm
Absolutely.
gonna be keeping a closer eye, because you just expect those people to do their job right.
Yeah,
You
Hmm.
yeah.
you don't think twice about a bill. Like, I
Hmm.
know my grandmother, anytime she gets a medical bill in the mail, she's paying it off. And my mom
Mm-hmm.
Hmm.
has had to tell her, like,
Hold
no,
on.
no.
Look first.
Let's make
Yeah.
sure that this is right. Because
Yeah,
Hmm.
what my mom went through with her parents in their medical bills, she's trying to help her mother-in-law, like, no, 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 let's make sure that
Hmm.
this is something you actually need to pay before you just send off a check.
yeah. And what
Absolutely.
Venus is also sharing, what I love about the bill is check the code. I believe you call it the CPT code.
Yes. Yeah.
Yeah,
CPT code. We do have a couple of codes, but the two most important is the CPT code. That's
what is
the
that?
current procedural terminology code. And what that actually tells is what type of service you had, whether it's an office visit, whether it's a colonoscopy, whether, it's anesthesia you receive. It tells what service you actually received.
Yeah,
Then you have the diagnosis code. And that's pretty much, as it states, the diagnosis, what the issue actually is. Do you have a cough? Are you wheezing? Did you get staples, stitches? Is it,
mhm,
COVID? Certain, it just describes your actual issue.
Okay.
Yeah, and it's so easy to make mistakes because in your book you also talk about several tests. Test
Mm-hmm.
A for that
Mm-hmm.
amount, test B for that amount, but
Mm-hmm.
sometimes they mention the same test twice on the bill.
Absolutely. Yeah. And that's where we call Miriam duplicate billing. And so, specifically, talking about what you just mentioned, the test, we're talking about a patient may have a cold, and you know how we want to do tests to see if, the influenza, do you have strep, or, they take the
Mm-hmm.
swab and they swab you. But it's
Mhm.
very important that they can take one swab, but actually they're testing for two separate things. That's why it's important when you are receiving treatment, open your mouth, communicate, with the provider. What are they doing, so that well, what type of test is this, and what does this do? You want to ask these questions, because when you get the bill and you look at the bill and you're being charged for a strep test and you're being charged for, let's say, I'm trying to think of something I can use as an example as a strep. Maybe they have a code on there where they gave you a breathing treatment. Did you
Mm-hmm.
have a breathing treatment? Did you have the strep? Did they test you for strep A and strep B? These
Yeah,
are the questions that you have to ask.
yeah,
So, are you saying that sometimes things can be on the bill that didn't even happen? Is that what
Absolutely.
I'm hearing?
yeah,
Absolutely.
yeah,
Yep.
yeah.
Look,
Absolutely.
look, I'm
And
gonna
I
be looking at
want
my
to
bills
say,
now.
yeah. So, and here's the thing, because I don't want anyone to think that it's done deliberately. We have coders that are humans, right?
Sure.
And sometimes, they're new to the industry. Maybe they don't know what code to use. They're reading from a provider's chart and they're trying to interpret what a provider is stating, and that's how your services are coded. So they may make a mistake.
Yeah.
That's why it's very important for you to understand the service that you are having rendered and what was done, because they do make mistakes. They're human.
Yeah,
Okay.
yeah. So, Venus, do you also suggest that when you receive a bill, you check
Mhm.
the bill right away and call your insurance company or provider? So, in your book, you're also talking about there's a possibility for patients to pay the provider in cash.
Mhm.
Would you really recommend that to pay in cash?
Um, so my recommendation for payment is, some people like to use cash, some people like to use cards, vice versa. The key thing to remember is keep track of how you paid, because
Uh-huh.
ultimately it's up to you. Myself, I don't really like to use cash. I like to use cards. I've heard
Paper
some
trail.
patients say they don't like to use cards because they don't trust that their information will be secure. As you know, well, maybe you may not know, Miriam. I don't know if this happens in the Netherlands, but there's a lot of identity theft and fraud that goes on in the US, and specifically with medical billing, as
Mm,
it relates to patients providing their financial information to make their payments. And quite frankly, some of them are just scared, to give that
Mhm.
information, or they just rather not. They rather pay in cash. The key thing to remember is get a receipt.
yeah,
Make sure you have a signature, of someone. Remember who you spoke with, who you paid, and just keep that documentation for your purposes, because you just never know. When you discard it, at that point, I would say discard it once you did get confirmation from the provider that this service has been taken care of, meaning after you've paid, you still have your receipt, but hey, I'm calling the provider to ask them, send me an itemized bill to show
yeah,
me on your documentation that this has been taken care of. And then myself, I still keep the receipt.
Okay. Yeah, I put in the comments, get and keep those receipts.
Absolutely.
But I do want to shout out, thank you, Tanja, for being here and sharing your experiences. She mentioned that we got a bill with all of our info, but we hadn't been to the hospital for the diagnosis that we were being billed for. We went in for a whole different case. What happens there? Like, how does that even happen?
So again, that could have been where they went in for service. Well, she said they hadn't even been to the hospital yet, correct? Is that what it
For
was?
that particular diagnosis. It was
Okay,
for
for that
different.
service. Yeah, and
Yeah.
that happens quite often. Okay. So
Oh,
I've seen where I've spoken and worked with patients who received a bill. In this case, they've never even been to the facility. They've never even been to the facility. So in this young lady's case that just shared here, she's saying that they did, but it wasn't for, anything that they had been seen for. And so it happens all the time. Again, it could be multiple things. One thing being, sometimes patients, this is one example, they have the same name and the records get mixed up, and someone who is keying that information is they're not thorough, not deliberately, I'm not going to say that, but the information, they're just not taking the time to make sure that they're documenting the correct account, and things get mixed up. Who knows? Maybe they were having a bad day and they just, had one record, and, they're doing this, doing that, multitasking, and just happen to, key in the wrong information on a wrong account. And maybe the service that they did have rendered didn't have rendered should have been on another patient's account. But it was placed on their account in error. So in that case, that would be a case where you definitely, that's why it's important to look over every bill that you get, because you want to make sure that you're being billed for, the service that you had rendered. Because in that case, in many cases, patients are receiving bills for services they didn't even have.
Wow.
you really have to be your own champion.
Yeah, you absolutely do. Or you have to have someone in your corner, especially, in situations where, you have an individual that's, sickly. You need an advocate. You cannot go at this alone. I don't think that, we should just, if you are, even if you're not sick, guys, you need to have an advocate, because if you're not going to take the time to look over your benefits and understand your benefits and what you are responsible for and not responsible for, you can pretty much be paying for things that you simply don't owe. You're just giving money away.
Yeah. So, Venus, can you share a little bit more about the doctor's stash? What is the doctor's stash?
Okay. And so that title, let me say this disclaimer, is not to discredit any provider or their billing staff. This is to get the community to really think about, money, the doctor's stash, what's going on. I'm trying to get you guys to make sure that what you're paying for as it relates to your medical care and treatment, that you really do owe it. Okay. And sometimes you have to take, not sometimes, you have to take the time to sit down and really review this information. So the doctor's stash is what I like to call, and this is just, what I created. It's a pile of money that sits in a bank account. So think about it. When the insurance company or you make a payment, the payment goes to the provider or the facility. Let's say that the insurance company denied the claim that was submitted on your behalf and said you absolutely did not owe this because we received this, it's past timely filing, is one example, or for whatever reason you're not responsible for it, okay? Authorization wasn't provided, wasn't given or submitted, and you're not responsible, but you paid for it. So if you paid for the service, sometimes patients will make payments up front if it's their deductible, co-insurance, co-pay. Sometimes I've seen patients, I don't know why, they want to just pay for the whole service up front until the insurance company pays. But if you never come back to get that money that the insurance company said that you did not owe, okay, it sits in an account, right? Of course, it's an organization. So, of course, they have overhead and they pay out and so forth. But overall, money comes from a claim that was submitted or a treatment that you paid for, and it sits in the bank. So, when you put your money in the bank, what happens to your money that goes in the bank?
Interest.
Good question.
So, if it sits there and I never give you your money back, it sits there and it grows interest. So if you look at it in the sense of where, excuse me, if you look at it in a sense, if it's, let's say, $1 million in an account, let's say the interest, well, we know the interest rates are not good right now, but even at 1%, $1 million, it's growing interest. Okay. And there's millions of dollars when you really delve into this book. There's millions of dollars that patients don't even know, that's due back to them, that still sits in the accounts, that's growing interest. That's growing interest. So that
So,
is the cash in the
yeah.
doctor's cash.
So the doctor's stash, if I'm hearing you correctly, literally
Mm-hmm.
just sits there until someone says, excuse me, can I figure out where my money is?
Absolutely. Absolutely. Until
So they're
either they
not
say
gonna,
where the money is, or until they get the opportunity to review it to say, hey, this
okay.
doesn't belong to us. It happens, but you got to think about it in this retrospect. If you have a very large organization, I'm just throwing these numbers out there of probably 50,000 doctors, and you have a staff of about, for these $50,000, of about maybe 20 people, and you have tons and tons and tons and tons of monies that were paid that the patient or the insurance company really didn't owe. How much can those 20 people get through, like literally, on 50,000 providers accounts in a month? Think about that. So you have to have the staff. It's not that they don't, want to give the money back, but it takes research sometimes, to determine, is the money really due back to the patient, or is it due back to the insurance company?
Wow.
And documentation is key, and they really have to review the documentation to determine, so many things happen through a transaction, when it relates to claims being paid by the insurance company or the patient, and what was said on the account. You have to really go through those accounts to really look at each individual, give it that special attention to make sure you're really doing it a service, to make sure that the patient, or the patient or the insurance company is really due that money back. It's just not as simple as you see a credit on the account and I'm going to refund the patient, or I'm going to refund the insurance company. You have to really do the research to see who that money is due back to.
But you as a patient can ask if you have credits on your account. Am I saying this right?
Absolutely. Yes. I tell everybody, when I say everybody, I mean everybody. Um, it doesn't matter the relationship that you have with your provider. I have a very good relationship with my provider. However, I always, at every time that I make an appointment, and I look at my medical claims very closely, I still ask, do I have a credit on my account? Do I have a credit on my account? And in some instances, I have had a credit on my account because they had me to pay a copay when I went to the office. However, when the insurance company processed the claim, I didn't know anything. I didn't know anything. And in this instance, I typically, when I go for my visits, I know the service that I'm having rendered. So I know what my out of pocket is supposed to be. But in this case, this particular day, there was a lot going on in the office. And, sometimes you don't want to, interfere with the staff, especially, when you notice certain things going on, like new training and so forth. So I know I'm one that I can, wait till my bill comes. I can look at it and I can see, what happened. Was I truly, billed for what I was supposed to be billed for? Do I owe anything? Do the provider owe me money back? But I know this because I'm familiar with the system, but someone who may not be familiar with the system, you may not know to ask. And so that's why I always tell people to ask every time you go to the doctors, do I have a credit on my account? And you guys will be surprised. Okay, you will really be surprised. I think in a book I talked about 17 years ago, you went to see a provider, and guess what? That money is still there in some instances. So you may say, well, 17 years ago, they didn't dissolve it, or, why is it still sitting there 17 years ago? They don't have the staff to do the research.
And what happens with the interest?
She says, she talks about it in her book.
I know. That's why I asked.
So when you say interest, the money is building up. This is revenue, right? Revenue for the organization, for the company, for the provider, and think about it. Staff have to get paid. The CEO have to get paid. The CFO has to get paid. You know what? Have you even considered what a hospital CEO or CFO makes?
No, I don't even want to know.
And I'm going to leave it there. I'll leave it there for you guys. And so it's just really important, guys, if I can't stress anything, to make sure you read your explanation of benefits, to understand your benefits, know what your benefits are, understand your out-of-pocket expenses, your co-pays, your co-insurances, your deductibles. When you're picking your plan, think about what I tell people all the time. When you're picking an insurance plan, I know us in the U.S., it's kind of tricky. It's almost like car insurance, so to speak. And when I say that, I compare it to in the U.S., we have what's called liability insurance. Where if something happens, it may just cover the other person's car. And then you have full coverage insurance where it would take care of a lot more. Your car, the person's car, a lot more. And so, we don't know, what we may come up against health-wise. So you have to really choose your benefits carefully, because I could be a healthy individual today, but a sickly one tomorrow. If I did not pick a plan that had certain things covered, then my out-of-pocket expense is going to be astronomical. Yeah. So it's very important to consider those factors, especially when you have a family, not even just a family, yourself in general. It's time to go to the hospital for my dad. Does he have the coverage that he needs? It's time for my aunt to go to the hospital. You guys read it in the book. We had to fight because she didn't have the insurance that certain providers would take in order for her to feel that she was getting the best treatment. Okay. We should be able to pick the providers that we want to be cared by, but the providers do not participate with some of the insurance companies, and it's their right. They are the ones who pick and choose who they want to contract with. So you may have a doctor that you're seeing today, but you change your insurance. And guess what? That doctor doesn't participate with that insurance. So you're going to pay a higher out-of-pocket expense. Then you're in the space of deciding, do I want to stay with this doctor? And pay this out-of-pocket expense, which is much higher than a in-network doctor, or do I want to change doctors, find another provider that I need to get comfortable with, and hope everything goes well, that I'm very comfortable with the treatment, the care that I'm receiving from that doctor. So it's just a lot. You really have to look at your benefits and make a decision on what's best for you and your family. You can't just say, hey, I'm going to just choose this one because I like the name. I've heard of Aetna. I'm going to choose Aetna because I heard they were a good insurance. I'm going to choose Blue Cross because I heard they were a good insurance. So here's the thing you guys need to know about that. Ashley, Miriam, and Venus can all three have Aetna. And all of our plans are different. They cover different things. Okay? What Ashley's may cover, Miriam's may not cover. Venus's may not cover either one of those, but we all have Aetna. Okay, so just because you have Aetna, all of us have Aetna, does not mean that we have the same coverage as it relates to different treatment and services. So do not pick the insurance based off the name. Or my cousin has Blue Cross. My aunt has Blue Cross. Their claims were paid. They don't have, their copays are this, it's less. They hardly pay anything. Every organization works with the insurance company contracting wise to decide what's going to be covered and what's not going to be covered.
So, like, if getting to Medicare, Medicaid, if someone they say that they have Medicare, Medicaid, but then there's like Blue Cross Blue Shield or CareSource, or those contract with Medicaid or Medicare, like how does that all work?
Sure. So what happens, you have what you call, as it relates to Medicare and Medicaid, you have the traditional pieces. Okay. The traditional pieces is when it's just the plain Medicaid and when it's just the plain Medicare A and B. Okay. Sometimes C, sometimes D. So what happens is now how Medicaid, back in the day, they weren't like this, but it's been a while now. Medicare and Medicaid have partnered with different insurance companies like your Aetna, your Blue Cross. And what they've done is certain benefits they cover what your traditional plan would not cover. And so it's called a managed healthcare organization. And so now with Medicaid and Medicaid specifically, let's say you get approved for Medicaid, they give you a window in where you're supposed to, select your managed healthcare organization. And again, the difference is the benefits. Okay. To traditional Medicare, Medicaid may not cover as much as the managed care organizations. And each of the benefits are different. You have a Mary Group, Americaid. It's so many different names, and especially different when you have the out of state Medicaid. Their names may be a little bit different from what we're used to here in the DMV area where I am. There may be a little difference in the names, but ultimately it's your managed healthcare organization, and the difference is the benefits. Okay. So they may pay a little bit more than just your traditional Medicaid. In some cases, I would say is good, just depending on, the individual circumstance. Sure. It just depends on the individual circumstance.
So just to follow up with that question, I don't know, Miriam, if you have a question. Did you have one?
Oh no, I do have
so what exactly, because just to bring this all together, what exactly do you do to help people just navigate? Like if they get a bill in the mail, they're just like, you know what? I was listening to that Venus senior talking. Now, what does she do? Because I need some help. I don't understand what I'm looking at. How can Venus
Absolutely.
help me?
So what I do is I sit down with you and I review your medical bills. If you have questions on what you owe and do not owe, if you're thinking that, hey, I may be due some money back, if you're wondering, hey, can I see this provider? How does this actually work? What questions should I be asking the provider? I help you navigate the system. So whatever your question is relating to you being seen by a provider as it relates to your insurance benefit before and after the service, the questions that you should ask before, the questions you should ask after, how to review your EOB, how to determine what you owe, what you don't owe, how to get any money back that's due from you, how to communicate, with the providers and make sure that you're getting timely responses. That is what I'm here for, to help you navigate the system and get the answers that you need. Because a lot of times, even with you calling into the offices, I'm sorry, sometimes you just don't get those answers. So that's what my service is, to help you to navigate it.
Okay, great. Yeah, and y'all, I put it in the comments, her website, and it's up here on the screen here. If you are looking for some help from Venus, I have told y'all time and time again on this channel, I believe in coaches and the extra help. Pay the people that are experts in the field, because they'll get you right, they'll get it right, and get you right. So definitely thank you for, just explaining deeper into some of these things, because, I can call I can call the billing department at my husband's hospital, and first of all, half the time they don't want to talk to me unless they hear his voice giving them permission to talk to me. And the way he is, he's like, will you please just talk to this woman, because she's going to be the one fighting for me. I don't know what's going on. He's just trying not to be sick.
Absolutely.
That's his job, to not be sick, to be healthy. So once I leap over that hurdle, then it's okay, I'm not understanding. And they're like, well, what are you not understanding? He doesn't have XYZ. And I'm like, but according to my paperwork, he does have XYZ. So it's like there's a standstill. So just helping people navigate this process. I'm so glad that you wrote a book on it. I'm so glad that you're offering your services for people to navigate this, because it's very hard and it's confusing.
Yeah, very confusing.
It's hard and confusing. And we caregivers, every now and then we need some time to breathe. So what I want to ask you, Venus, do you have any tips for caregivers who want to apply for respite care?
Oh, that's a good one too.
Yeah. So what I would suggest to you guys is to look at all benefits. Let me ask this, because I don't know, where do you guys get your benefits from?
Ashley?
Oh, me? Well, for him specifically, it's Medicare, Medicaid. I'm an entrepreneur, so I just get whatever. I get whatever the healthcare is. I don't even know. See, I don't even know my own, because I barely go to the doctor. That's sad.
Okay. Well, we have to change that, Ashley. We'll talk more offline about that.
Ma'am. Yes, ma'am.
But Miriam, what I would suggest ultimately is just start reaching out to the different carriers and look to see what they have to offer. And then from there, they should be able to give you details about, what they offer as it relates to caregiving services. All plans, I mean, they offer so much, and each plan has a variety of things that can assist you. It's just a matter of connecting with that plan and asking the questions. I don't particularly deal with that piece of it. I just deal with the piece of once your benefits are in place, and things get to going through that cycle, I am the one that helps you to make sure things have been done correctly.
See, another gem.
Mm-hmm.
Yeah.
Amazing. Yep. So, what if you can't pay your bill? Can you negotiate?
Absolutely.
See,
So,
that's love.
absolutely. So, a couple of things. When you don't have means to pay your bills, the first thing that you want to do is speak with that provider's office. See if they offer self-pay discounts. Okay. Self-pay discounts is one way. Another important piece to that is financial assistance. Okay, some providers, all providers, they operate differently when it comes to the financial assistant piece. Some providers may say, if you have insurance at all, we can help you. But there are some providers, if you have insurance, they're willing still to look at your financial situation to determine if they are able to assist you with adjustments, and sometimes talk to the provider themselves, especially if you have a good relationship with the provider, because ultimately your answer is in the hands of several different people. It could be the billing office itself, where you just get that flat out answer, no, or we can help you with this. But if you go to your provider and you have that relationship, you could possibly get some additional discounts just by communicating with them. So there is self-pay discounts that you can ask for when you absolutely do not have insurance. And then I've seen that to be anywhere from 15% to 25. Again, depending upon your relationship with the provider, they may even discount it for more. But you want to make sure also that you do, patients that don't have insurance, explore your resources. And what I mean by that is Medicaid. Apply to see if you would qualify for Medicaid. And if so, for most Medicaid, whatever they pay out, the patient is typically not responsible for anything. If anything, it's a small copay. A very small copay. I've seen it be from $0 to maybe $15 at the most, if that. Um, if that. But for the most part, once Medicaid pays, you should know anything.
Wow.
Okay, so that's self-pay discounts. You would ask for financial assistance. You would ask for, and also apply for Medicaid.
You're muted, Ashley.
Sorry, they're out here cutting grass and stuff, so I had to mute myself. So what about if you've gone through that whole process and they're still saying, we don't want to negotiate any kind of smaller price or anything, what do you suggest then?
Then I would ask for a budget plan. Ask
Okay.
them to put you, if they don't want a discount in any, you ask for self-pay discounts. You can ask for prompt pay discounts. Hey, if I pay this right now, are you willing to waive the rest? I've seen it discounted at 25%, 50%. Because they want to get paid for the service. And sometimes by the time they send it to collections, collections gets about estimated 20% off of what they've sent over to them, when they can just assist you, and give you the discount and don't even have to worry about the collection piece.
Okay. Hey, I just wanted to bring Miss Veronica on the stage because she's been engaging, and I know she's like ready for a question, I think. So I just wanted to bring her to the stage. I hope y'all don't mind. Miss Veronica, please. What question? I know you got a question or
You know,
something.
I have a prayer.
Oh, okay. Okay, she coming to pray. Pray over these bills that they disappeared.
Oh my goodness.
Okay.
Good to see you, ladies.
You
But
too.
wow. I never knew any of this.
Mm-hmm.
This is you have a lot of wisdom and a lot of knowledge. And it's been awesome for you to be able to share it with us. I'm 53 and just now learning a lot of this. I mean, I go to the doctor, I'm that one that gives the money, the whole nine. But I will be asking, do I have a credit? Because, honey, I can date way back on how long I've been going to the doctor. But my prayer for you, well, first of all, Miriam, honey, thank God for the benevolence that, you ain't got to do, but $20, that's not our story here.
Mm-hmm.
Not our story here.
Mm-hmm.
On Medicare, I'm sorry, because I was on Medicaid. I'm on Medicare, but you'd be amazed on what is accepted and what is not,
Yeah.
what doctors accept and what doctors don't, what
Mm-hmm.
pay, what is not accepted. It's been unbelievable to me. Like I commented, they will stop your visits if you owe a bill.
Uh-huh.
And I have edema in my right leg, and they were wrapping it. And in between switching Medicare, like Plus, Advantage, or whatever you want to call it, in between there, was keep going to the visits, but then I got a $927 bill.
Well,
They stopped me from coming to get my leg wrapped until that bill was paid.
Until the bill.
Yeah, they might not do it now, but it was on my credit report. Made it look as though she doesn't pay her bills. No, that was not the story, ma'am, sir. That was not the story. But all this wisdom and knowledge today, my prayer for you is that you continue to give it out, continue to help, because it's a sad thing. I'm loving to see our Black faces on here. Me and Ashley, well, I'm married to somebody, a Caucasian, and it is what it is. They look out for them, and I'm that honest wife. Y'all look out for y'all. We have to look out for us. And this is amazing that you have this much wisdom and knowledge to give. You've wrote a book and you're giving it out. So my prayer is that God continues to give the three of you more wisdom, more knowledge, for Ashley to be able to bring more people to give us this wisdom and knowledge that you guys have. It's amazing. God bless you. I'm sorry for the different losses, but I'm excited for the gains of the knowledge and wisdom that God has given you, and that he continues to give you, and you continue to give it out unto us.
And
Absolutely.
Veronica, I love that you brought that up, because my closing question to Venus was actually going to be what she has in store. And for that prayer to just go on into Venus, let the people know what your big vision is, what you have planned.
Okay.
Because Veronica, if I let Veronica keep going, she gonna preach, because that's what she does. So, but I'm gonna say Veronica doesn't even know, but she came on here to pray over what you've got coming. So please share with everyone what you've got coming, Venus.
Absolutely. And that was nothing but confirmation. Whew. Okay. So I've been actually, this has been a passion of mine for many, many years. As I explained to Miriam, and Ashley, this is not the path that I thought I would take. I ended up in this to help patients. And when I tell you I'm so passionate about it, I'm so passionate about it.
You can tell.
I have been, ooh, okay. I'm sorry.
No, take your time.
Let me tell you guys what's in store. I want to help you guys so much so. We talk about how we give back, how we be of service to people.
Yeah.
In the beginning, this business, I wanted to help people so much. But this is a business in where I want to give back. I want God to get the glory from it.
That's it.
With that being said, I'm working on an organization, nonprofit, to where I will be raising money to help pay medical bills.
My God.
All monies and proceeds will go to help people pay medical bills. None of it will be, it would not be personal. It will be personal on the fact that it will be helping to pay your medical bill. Your medical bill. It's so much, so many bills that are out there that truly you do not owe. I was working with a patient client the other day to where he's in the process of purchasing a home, and unbeknownst to him, as you know, the mortgage lender runs his credit. He has over a $3,000 bill on his credit report.
Yep.
And speaking with him, and me doing the research for him and helping him, come to find out he provided his information 2 years ago. It was the lack of understanding of the staff that assisted him and didn't get his information in the system and failed to give him a bill. He's been fighting, and I've been advocating for him, and we're still waiting on the final result. But guess what? Because I know this man, I saw his insurance card. He's been insured since 2012. Why wouldn't you give your insurance information if you've been insured since 2012? There's no way you should be in with the credit bureau, and especially if you had other services that were paid by the insurance.
Yeah.
So guess what? If his bill didn't get paid and I had this non-for-profit, he wouldn't have to go through this. It will be paid for those patients that cannot afford medical care or to pay their bills even after insurance, because there are some cases like that where they really can't afford to pay. That is where this nonprofit is going to come in, and it's going to pay for medical bills. I am going to be partnering with an organization, and you guys can look them up. They're called Rest in Peace Medical Debt. You may have seen them on Facebook, where they have also been paying medical bills for people. And that is my heart. That is my passion. So I thank you for coming on and giving that confirmation, because I'm going to do everything in my power to make sure that it comes to pass. Medical bills are paid when you cannot afford to pay them, when you just don't understand, when no one took the time to explain to you the process, and then you end up with just a ton of medical bills that you just didn't understand. You're sick. You're focusing on your treatment, your care. The providers are focusing on your treatment, on your care. They're expecting the business office part of it, the administrative part of it, to do their part. And when you don't have people as passionate to take the time to make sure that the T's are crossed, the I's are dotted, then that's where we fall in these pits. That's when you have these medical billing pitfalls. And I'm here to tell you, as God is be my witness, your confirmation today, we will, this nonprofit will get up and running, and you guys, this is you will hear more. We will get bills paid. We will have services where we can, help and provide it, educate at no cost to the patients. That is key. You can't, I mean, if you need help with your medical bills, you know, we should be
Okay,
there to be
that's
able to
good.
help you. The information is there, but you just have to be educated on it and get the understanding. So, yes, nonprofit is coming. Just, be on the lookout. You will hear more about it soon, very soon.
Wonderful. Wonderful.
Beautiful.
Thank you,
That's amazing.
Venus. Yeah, I've been dropping everybody that's tuning in now or that will tune in on the replay. I've dropped her her IG, her Facebook, also where you can find her book, her website. If you're needing a sleuth, a detective, we're talking to her right now.
Absolutely.
Absolutely keep your eye out for what Venus has coming. She's not done.
Not by far.
And so we definitely appreciate you being here with us, Venus. And it's probably not going to be the last time because Miriam and I like to talk. So it probably won't be the last time. We really appreciate you. This was a long time in the making.
Yes.
And I do want to give a huge shout out to Sarah, our collective writing coach, because without you, Dr. Sarah,
yes,
we would not even be talking. She has helped all three of us. She was our writing coach and our editor. So thank you for introducing us and bringing us together. I just really appreciate what you're doing and what you're going to be doing, Venus. It's so necessary. I will be, you know what? I'm going to give 2 books away. So I will be collecting the names of everybody who was on the live today, and I'll be giving out 2 books from Venus. Is your cash in your doctor's stash? And you all, if you didn't get the passion this woman has off this screen within the first 2 chapters of her book, you're going to be sitting there crying because I cried. Y'all know I'm a crier though. Anyways, it's because you can feel her passion jumping off the page to help people get rid of this crushing debt that we don't need. Even if you're not a caregiver, even if you're not the one sick, you just want to be healthy. You don't want to have to worry about $1,000 bill coming in the mail, because then that might just give you a whole nother tailspin of anxiety. We don't need that. We have people in place like Venus who's there, really, really cares about the situation, about these medical bills, and how to help those find the cash in their doctor's stash. Miriam, Venus, do you have any closing remarks?
There's only one thing I want to share. You know what I love about your book, Venus? The tips you share, talking about healthcare providers. I've written it down, so I'm reading it right now. What to do when reviewing your bill, the best method of payment, the blank pages. Guys, let me show you what Venus. This is just amazing. So after you're just not only reading her book. Look at the gem. Here's the screen. You can write your notes after reading the book, your own situation. So she's dropping so many gems. I mean, I don't live in the USA. I live in the Netherlands. But even for me, this book is so valuable because I do help people from the USA, from all over the world. So it's important for me to know the things she shared today. So, Venus, thank you so much.
You're welcome. You're welcome. And then lastly, I just want to say that share this book, guys, with everyone that you know. I'm sure this is the first, but it will not be the last. And
only the beginning.
Yeah, just the beginning. And I want you to know that I'm both a patient advocate and a provider advocate. Okay. I teach them to be able to bill your services correctly and bill you correctly. And I teach you how to understand what it is that you're receiving bills for and how to navigate the system. As I explained earlier, remember, it is a cycle. It is a cycle. And I post that cycle on my Instagram pages, my social media pages, so you guys can look at it and see and begin to process and think about it. But I want you to know to share this book with everyone you know. Tell them to share it. The proceeds from the book is actually being directed to building this nonprofit organization. Okay. So I want you guys to know that it is a purpose. It's a purpose for this, because there's so many people that need help. And as you read the book again in chapter 2, there are hundreds of thousands of people that receive bills that are not theirs, that should not be billed to them for whatever reason. Okay. So share this book and know that your purchase of the book is going towards a good cause. Okay. And that's to help individuals to pay for this medical debt.
Perfect.
Wonderful.
Thank you so much, Venus, again. And y'all, you haven't seen the last of her. And of course, you ain't seen the last of Miriam and I. So thank you guys for tuning in. And for those that will do, watch the replay, thank you so much. Like, follow, and just watch what Venus does. Watch her, okay? Thank you so much, everybody, for tuning in. Peace.
Thank you. You guys have a wonderful
Bless
day.
you all.
You too.